Good morning, friends, and welcome to today's lecture on World Anti-Doping Agency Prohibited List. This is the week 2 lecture, lecture 1. I'm Professor Dobson Dominic and I'm your anti-doping course facilitator. In the week 1, we looked into the history of international anti-doping, the history behind doping in India, the history of doping in Olympics. We also looked into World Anti-Doping Agency Code. So today we are going to look into the comprehensive World Anti-Doping Agency's prohibited list. So this week, in week 2, we are going to look into the World Anti-Doping Agency prohibited list. What are the substances prohibited in competition 1D? What are the prohibited methods? What are the prohibited drug side effects? And what are the long-term side effects of doping? These are the broad outline for today's discussion. We'll first look into the World Anti-Doping Agency prohibited list 2025. What are the substances which are prohibited at all times? We'll see what all the substances which are prohibited only during the competition. We'll see what are the prohibited substances and methods. We'll see what are the major modifications which has happened from 2024 by WADA. This is a broad list of WADA's 2025 prohibited list. S0 stands for non-approved substances, S1 for anabolic androgenic steroids, S2 for peptide hormones, S3 for beta-2 agonist, S4 for hormones and metabolic modulators, S5 for diuretics and masking agents, S6 for stimulants, S7 for narcotics, S8 for cannabinoids, S9 for glucocorticoids. P1, that is in particular sport, is for beta blockers. Then we have 3 methods which are banned. M1 for manipulation of blood and blood components, M2 for chemical and physical manipulation, and M3 for the newer gene and cell doping. Prohibited list criteria. For a substance or method to be considered for inclusion in the WADA banned list, 2 of the 3 following criteria must be met. 1. Potential to enhance sports performance. 2. Actual or potential health risk to the athlete. 3. Violates the spirit of the sport. If either the drug or the method satisfies 2 of these 3 following criteria, then that drug or method will be banned. WADA prohibited list, sport specificity. Some drugs are prohibited at all times. Examples are anabolic androgenic steroids. Some drugs are prohibited only during competition. Example, amphetamines or stimulants. Some drugs are banned above the specific threshold dosage, and some drugs are banned in particular specific sport. Now, looking into what are the drugs which are prohibited at all times. Prohibited substance S0 is non-approved substance, S1 is anabolic agents, substance 2, S2 is peptide hormones, growth factors, related substances and mimetics, S3 is for beta-2 agonists or beta blockers, S4 for hormones and metabolic modulators, S5 for diuretics and masking agents. Let's look into each of this. S0, what is S0? This is a group of drugs or substances which are non-approved. Any pharmacological substance not covered in the list and lacking current approval from any government regulatory authority for human therapeutic use. What are they? Drugs in preclinical or clinical development. So, drugs which are not approved can never be used. Discontinued drugs. Some drugs are used and then discontinued. They cannot be used. Designer drugs cannot be used, or substances approved solely for veterinary use, that is use in animals, is also prohibited at all times. So, these are substances which are non-approved and are prohibited at all times for the athletes. Substance 1, anabolic agents. S1.1 stands for anabolic androgenic steroids and S12 stands for other anabolic agents. Substances that have both anabolic, that is tissue building, and androgenic, that is masculinizing properties. Anabolic androgenic steroids can be derived both endogenously, that is in a natural form, as well as exogenously in a synthetic form. Athletes in sports like weightlifting, throwing, like shot put, discus throw, they abuse this performance enhancing drug to increase the muscle's power and muscle strength. Okay, having this anabolic drugs have several side effects which we'll look later in the subsequent weeks lectures. Second substance which is banned at all times is peptide hormones, growth factors and growth factor modulators. Again, S2 substance are banned at all times. What are they? EPO and agents, that is erythropoietins, which affecting erythropoiesis. EPO's role is to increase red blood corpuscles in blood and is used by athletes particularly in endurance sports like cycling and in marathon running. S22 stands for peptide hormones and the releasing factors. Peptide and glycoprotein hormones are natural substances that act as messengers within human body and triggers production of other hormones endogenously like testosterone. S23 stands for growth factors and growth factor modulators. What are they? Examples are synthetic drugs like HCG, human chorionic gonadotropin, HGH or ACTH. They are all used by athletes for muscle strength. So, this group of S2 substance 2 peptide hormones, growth factors and growth factor modulators are banned at all times during the sport. Substance 3 or S3 stands for beta 2 agonist. Beta 2 agonist, if taken in bloodstream, have anabolic effects, that is tissue building or muscle building effect, and hence World Anti-Doping Agency has prohibited this substance use of beta 2 agonists by athletes. There are certain exceptions where there is genuine medical need in certain conditions like bronchial asthma. Even athletes can suffer from childhood asthma, which can even prevail to adult asthma. That is the time when medical form of inhaled salbutamol, inhaled formoterol and inhaled salmeterol, inhaled vilanterol are given. So, this beta 2 agonist, if taken in a medical condition, the athlete and the support staff definitely has to follow one important principle, that is you need to apply prior to the usage of this drug a TUE certificate. What does TUE stand for? Therapeutic use exemption is mandatory for usage of inhaled beta 2 agonist. Based on the recent publication, the doses of inhaled formoterol was were updated to ensure that the ergogenic effects are not achieved. Okay, so this is a newer modification in the 2025 guidelines. So WADA comes up with periodic modification in the usage of beta 2 agonist. S4 or substance 4 stands for hormone and metabolic modulators. Again, these are banned at all times. S41 stands for aromatase inhibitors. S42 stands for anti-estrogenic substance like anti-estrogens and selective estrogen receptor modulators, commonly known as SERMs. And S43 stands for agents preventing activin receptor activation, and S4 stands for metabolic modulators. Please do understand these substances may be illegally taken by athletes to counteract undesirable effects associated with anabolic steroids. When athletes take anabolic steroids, which are banned at all times, to mask the effect or to mask the side effect of anabolic steroids, some side effects like gynecomastia, athletes also take these hormone and metabolic modulators along with anabolic steroids in the preconceived notion that they can overcome the side effects. Okay, so again here recently in 2025 guidelines, Electrasent was added as an example of anti-estrogen, and so these are banned at all the times. S5 or substance 5 stands for diuretics and masking agents. So what are they? These are substances which have the potential to impair excretion of prohibited substances, to conceal the presence in urine or other doping control samples, or to increase the hematological parameters. So basically athletes take these substances as a form of masking agent. Certain diuretics are medically indicated. Examples are drospirenone and pambrom. Also topical ophthalmic administration of carbonic anhydrase inhibitors like dorzolamide and brinzolamide are permitted with proper TUE, therapeutic use exemption, and also permitted is a local administration of felipressin in dental anesthesia. So most of the times diuretics and masking agents are banned at all times. Only in certain exceptions like in dental anesthetics usage and topical ophthalmic administration, medically it is approved to use diuretics and masking agents. 2025 guidelines of WADA, cipamide was added as an example of a diuretic. Now we have looked into substances which are banned at all times. There are certain substances which are banned only during competition. What are they? S6, substance 6 stands for stimulants. S7, substance 7 stands for narcotics. S8 stands for cannabinoids, and S9 stands for glucocorticoids. Let's look into that. S6, stimulant. Stimulants are particularly substances which have a direct stimulating effect on the central nervous system. Which group of athletes abuse this? Especially athletes who are involved in endurance sports like cycling. If you have followed the first week's lecture, stimulants were one of the earliest misused performance enhancing drug, especially amphetamines. Cocaine and ephedrine are examples of stimulants which are particularly used by endurance athletes like cyclists and marathoners. This helps the athletes stay alert. Wakefulness is important in the sport, and it also enables them to increase their ability in concentration. The next group of drugs which are banned in particular during the competition are narcotics. Narcotics are prohibited in sports are those derived from morphine and its chemical and pharmacological analogues. Narcotics are substances which act on central nervous system and reduce the pain sensation. Use of narcotics cause a false sense of cure in an injured athlete that leads to ignorance of a potentially serious injury and risking further damage. What happens is athletes, when they are injured significantly, especially in musculoskeletal conditions, if they have suffered a serious anterior cruciate ligament injury which might recur a long term away from the sport, then they need to be for a long term 6 months to 1 years in rehabilitation. This is the time when they are also in pain during the rehab phase. They abuse this narcotic medications, especially athletes who are injured and also athletes who are trying to quickly get back to the sport, that is during the phase of return to play. This is the time when narcotics are misused. The next group of drugs which are banned during competition is cannabinoids. Cannabinoids are psychoactive chemicals like marjuna, hashish and hashish oils, which are all derived from the cannabis plant. The main issue with cannabis is prolonged usage of cannabinoids can result in loss of motivation, decreased concentration, impaired memory and learning disability, even respiratory disorders like lung cancer, throat cancer and chronic bronchitis can happen with prolonged usage of cannabinoids. So usage of cannabinoids can lead to addictive tendencies. Again, cannabinoids are prohibited during competition. Substance 9 and S9 group of drugs which are banned during competition is glucocorticoids. All glucocorticoids are prohibited when administered by any injectable or oral, including oromucosal, buccal, gingival, sublingual or by rectal route. Other routes of administrations which are medically indicated like inhaled glucocorticoids and topical glucocorticoids, dental, intracanal, dermal, intranasal, ophthalmological and perianal are not prohibited when used with a therapeutic use exemption certificate and proper manufacturer's licensed dosage. So remember, glucocorticoids are banned during competition in injectable and oral forms, also rectal route. The other routes of administration, it is not prohibited provided the athlete has a valid TUE certificate. So we looked into substances which are banned at all times. We looked into substances which are banned only during competition. Now we are going to look into substances which are banned particularly in certain sports. What are they? So P1 stands for particular. Particular sports, main group of drugs which are banned are beta blockers. These group of drugs may be illegally taken by athletes, especially in precision sports. What are precision sports? Examples of precision sports are archery and shooting, where they require accuracy and steady limbs. They need to be constantly keeping the limb in a stationary form with long periods of concentration. Okay, this two sport, beta blockers are banned at all times. Okay, if at all beta blockers are going to be used, only with adequate TUE certificate they can be given. There are certain sports where beta blockers are banned only during that competition. What are they? Examples of those particular sport are automobiles, billiards, darts, darting competition, golfing, skiing, snowboarding, underwater sports, especially in all subdisciplines like diving, spearfishing, target shooting, all these sports, beta blockers are banned only during competition. We looked into the banned substances. Now let's look into what are the banned prohibited methods under WADA. M1 stands for manipulation of blood and blood components. M2 stands for method. M2 stands for chemical and physical manipulation. Method 3, M3 stands for gene, genetic and cellular doping. So these are the references you can look into. WADA has a comprehensive, WADA website gives you a comprehensive where it clearly states the comprehensive list for that particular year. 2025 list is already out. So any newer addition in banned drugs, any newer methods will very well be updated in WADA. These are the references. Thank you for listening and Jai Hind.